So, good day to each and everyone. I am here to discuss about the introduction to the artificial respirations and cardiopulmonary resuscitation. Artificial respirations, or the AR, is a procedure to manually pump or blow air into the lungs of a person when his or her normal breathing is inadequate or has a cease. So, ang artificial respirations, ito yung procedure sa isang tao pag yung isang tao ay merong cease or inadequate yung kanyang pag-breathe. Ang first aid na ginagamit dito is yung pag-blow ng mouth to mouth or yung pag-pump ng dibdib ng isang biktima. Then the cardiopulmonary resuscitations, or the CPR, is an emergency procedure done to continue the circulation of oxygen and blood inside the person's body when cardiac and respiratory functioning has stopped. This is an effort to preserve brain functioning by allowing oxygen to circulate from the lungs to the brain arteries. So, ang CPR is isang medical procedure na ginagawa kung ang isang tao ay nawala ng malay at hindi na tumitibok yung puso or humihinga. Ang cardio ay tumutukoy sa puso, samantalang ang pulmonary ay sa baga or sa paghinga. Then, mahalaga na magawa ng tama yung CPR upang mas madagdagan yung tsansa ng isang tao na maisalba yung kanyang buhay o yung buhay ng isang tao. Defibrillator is a machine used parallel with CPR that delivers a measured amount of electric shock to restore an appropriate rhythm for the heart's natural pacemaker. Then, ang defibrillator ay yung machine na ginagamit ng mga rescuer. Then, ang Ventilation is an action by the first aider in the administration of CPR that allows air to enter the lungs of the patient either by mouth-to-mouth delivery or by the artificial way or the endotracheal tube. Ang ventilation naman is yung medical care na ginagawa ng mga rescuer sa pamamagitan ng pag-CPR sa isang patient or sa isang biktima gamit yung mouth-to-mouth so that the victim can breathe easily. Comprehension is an action by the first aider in the administrations of CPR wherein the hands and arms are used to manually pump the heart of the victim in a definite rhythm to continue the circulation of blood from the lungs to the heart to the brain when cardiac functioning has stopped. So, ang comprehensions, ito naman yung action ng isang nurse or ng isang rescuer or medical assistant. Then, ginagamit dito is yung pag-pump ng dibdib ng biktima gamit yung kamay ng mga rescuer. Then, yung habang pinapump nila yung dibdib ng isang biktima or ng patient, merong chance na yung circulations ng heart to brain ay mag-continue. Methods of conducting AR and CPR. Number 1, survey the scene in every rescue safety, the primary consideration. Unang-una, alamin natin yung punot dulo ng pangyayari kung bakit at ano ang nangyari sa biktima. Number 2, introduce yourself in the public. You may introduce yourself this way. For example, I am blank or I am Racy M. Huelba, trained first aider and rescuer. May I help? Then number 3, tap the shoulder of the victim 3 times to assess for responsiveness. So, itatap natin or tatapikin natin yung biktima sa dibdib niya ng 3 beses para makita natin kung magre-respond pa siya. And pag nag-respond siya, yung pwede mong sabihin na, "Hey sir, are you okay? May masakit ba?" Ganon. Maaari natin siya matanong. Ngayon 3 beses. Ulitin natin yon. And then, pag yung biktima is nag-respond sa kahit ano, kung hindi man siya makapagsalita, maaari naman siyang sa kanyang reaction gamit ang kamay or sa facial reaction niya. Then, kapag naman hindi siya nakapag-respond, so, maaari natin siyang dalhin na sa malapit na hospital. Kasi need talaga natin ng respond ng biktima bago natin siya i-CPR so that alam natin yung gagawin na okay pa siya, kailangan pa makakaya pa siya sa pag-CPR. Number 4, ask for help and active medical assistant or EMS, emergency medical services. So maaari tayong magtanong sa kakilala natin na may alam din pagdating sa medical care or pwede din sa emergency medical services. If the victim is unresponsive, the rescuer shall request a specific person to call for an ambulance or vehicle for transportations. So, kapag naman ang biktima ay under-response or hindi nagre-respond sa kahit anong ginagawa natin, maaari tayong tumawag ng kakilala natin or ng nasa paligid natin na sabihan natin sila na tumawag sila ng ambulansya para ganon madala natin agad yung biktima halalong madaling panahon sa malapit na ospital. While the rescuer does not know anyone in the area, then ask the person nearby to active EMS. The person may be identified by the color of the shirt or by asking his or her name. Rescuer may be guided with the letters DCAPBTELS in the preliminary survey. The DCAPBTELS means D for deformity, C for contusions, A for abrasions, P for puncture, B for burn, T for tenderness, L for lacerations, and S for swelling. Number 5, check for vital functioning. So, kailangan nating i-check yung kanyang vital functioning. If the victim is under-responsive, check the pulse and breathing for about 5 seconds. So, kapag yung biktima ay hindi nga nagre-respond, maaari nating i-check yung pulse niya ng 5 segundo. Kung tumitibok pa ba yung kanyang puso or meron pa ba siyang pulso. Apply look, listen, feel to assess breathing and check the radial or carotid pulse of the victim to assess circulation such as shown in the picture. So, makikita naman sa picture kung paano yung sinasabi ko, yung pag-check ng pulso ng biktima or ng heartbeat ng biktima gamit yung pag-tap lang ng kanyang pulso or pwede dito sa may leg kasi makikita din naman sa may leg yung heartbeat ng isang tao. Number 6, if breathing is negative but the pulse of the victim is positive, perform artificial respirations or the AL by the following procedure. Number 1, remove any foreign object inside the mouth such as dentures or retainers. If there are fluids in the mouth, turn the patient sideways to drain the fluid with gravity. So, kung ang biktima naman ay merong brace or kung ano man nakalagay sa kanyang mouth, maaari natin siyang alisin muna. Then, open airway using the head tilt chin lip method or the jaw thrust method if there is unsuspected spinal injury. So, una, ititingala natin siya, tapos hahawakan yung baba, then open the mouth para makapaglabas siya ng hininga niya or para makahinga siya ng maayos pag inopen natin yung mouth niya. 7. If breathing and pulse are negative, apply Cardiopulmonary resuscitations or the CPR. Shock first. If the rescuer is trained in using a defibrillator and the machine is available, deliver 1 shock then proceed with CPR. So, sinasabi ko nga po yung defibrillator is ito yung machine na ginagamit para matukoy kung okay pa ba yung heartbeat ng isang pasyente. Put the victim on his or her back and to a flat, hard surface or cardiac board if available. So, ilalagay natin yung biktima sa maayos na higaan or flat na higaan. Kung meron naman na cardiac board is lalong magaling para mas maayos mag-function yung kanyang daloy ng paghinga or ng kanyang puso. Spell cub. or CAB, the circulations, airway, and breathing. Apply 30 comprehensions by following this procedure. Kneel next to the first heel of the dominant hand on the center of the victim chest, between the nipples if male, or between the breasts if female. Place the non-dominant hand over the dominant hand. Interlace the fingers but make sure the force is delivered onto the heel of the hand or not on the fingers. Keep elbows straight and position shoulders directly above the hands. Use the force from the shoulder and arms to push straight down on the chest for at least 2 inches in depth. Push hard at the rate of 100 comprehensions per minute. After 30 comprehensions, deliver 2 ventilations, the following procedure for artificial respirations. 30 comprehensions with 2 ventilations is 1 cycle. Perform 5 cycles, then reassess vital functioning. If the vital functioning returns, place the victims in recovery positions if there is no suspected spinal injury and wait for medical assistance. If vital functioning is absent, perform another 5 cycles until medical assistance arrives. Do not stop until the 5 cycles are completed. If not, she may substitute and continue the cycles of the first aid if the first rescuer is exhausted. If medical assistance arrives before the 5 cycles are done, inform the medic on the number of the cycles you have performed so that he or she will allow you to finish before they will take over.